Joe. Welcome back. Looking forward to today's edition of the top three healthcare headlines you need to know from Tallahassee. Hope you had a great Easter weekend. I'm going to introduce yourself and then throw it back to me, and I'll kind of kick things off for this week.
Yeah, that sounds good. My name is Joe Daraskevich, and I work for several medical societies and associations across the state of Florida. And to answer your question, I did have a very nice Easter with the family. My toddler may have had too much candy, but we blew up a bounce house in our backyard last night, and that got a lot of the extra energy out. So I'm looking forward to talking about the headlines from Tallahassee again with you this week, Fraser.
Fantastic. Yeah, and I'm Fraser Cobbe. I'm the executive director of a number of the county medical societies in the state, as well as some of the special societies too. And we kind of had a low key Easter, my wife and I, but feasted quite a lot yesterday. So ready for a action-packed week ahead. I think before we get started, Joe, we do need to start on a bit of a somber note, just referencing the shooting last week at FSU. And we did have an opportunity to put out a notice from the president of Duval County Medical Society, Dr. Kez Ryan, just reminding folks about these unfortunate situations, terrible tragedies that occur, and some good work we've done in the advocacy arena in the past with passing the Stop the Bleed kits and funding that are available now through the state. So just a reminder on what we can all do to continue to try to address those situations and do so responsibly. And there is some educational materials out there available that the state has previously funded. So certainly our county societies will be looking at ways to continue to spread that education throughout our communities.
Yeah, and that's a great note to just mention. Touches a lot of people across the state, whether it's a state school that you have a child at, or you've attended yourself, or Tallahassee, the Tallahassee community. We're all over there for advocacy stuff. So, yeah, we'll start it with a somber note, and just know that we have those resources available for people if they're interested. Just reach out, please.
Absolutely. So I think with that, looking at the calendar, we only have 2 weeks left of session here. So things are wrapping up quickly, and that kind of um, trails itself throughout our comments in today's headlines. So look forward to diving into this with you, Joe.
Yeah, let's get going. And yeah, I know it's almost bittersweet. We at the beginning we're all full of enthusiasm and excitement about the things to come, and now we kind of see everything as it is. And yeah, the time's running out. So let's jump right in. We'll, as we do each week, we talk about three headlines from Tallahassee and how they affect the healthcare community. So we're going to jump right in and get started. Our first one today, Fraser. Florida's bipartisan fight against fentanyl remains at forefront in Tallahassee. What's that fight? What's the latest with that fight?
Yeah, so it's a good way to start this week. 'Cause it reminds us that, especially in Tallahassee, there are opportunities for both parties to get together. There's a narrative that the two parties don't work together very often, but whether that be in DC or Tallahassee. But this is a great example where it's been a bipartisan effort for a number of years to help the state deal with the fentanyl crisis. So this legislation was sponsored by two Democrats, Representative Harris in Orlando and Senator Polsky from Boca down south, and it has passed both chambers and now been signed and sent to the governor. It does expand testing for fentanyl when a patient comes in the ER and they have been treated for overdose. It makes sure that they get tested for fentanyl, which can linger in the system a little while longer, just to make sure that those patients get ongoing care they may need. It's called Gage's Law after an unfortunate situation where an individual passed away after an overdose. So just figured I would bring us together with our first headline of the parties working together to address an ongoing crisis that impacts the healthcare community and nobody else here in the state of Florida.
Yeah, well, and that is a good reminder that everyone's working together to get a lot of things done. And is this though? Is it something that we've talked about all these butting heads over the weeks behind? Is that something that maybe they say, hey, we all came together for something that we really can agree upon. Let's come together on other things. Is this maybe some strategy here that they're kind of seeing the finish line coming, or what do you think about that?
I don't think so. I think the state leadership has been laser focused on fentanyl and the impact it's had. And of course, we've had a number of different bills pass over the last several years trying to get our arms around that crisis. So, no, I think it's just an example of a good public policy that can originate from any party, and everybody kind of coalesces around that idea and pushes it forward. So, I don't think it sends really a message or illustrates anything other than our ongoing commitment to deal with that issue.
Yeah, and that would be a strange topic to for someone to come out and be vocal against. Obviously, everyone knows it's a crisis. So, anyway, well, I think that's a good thing. That's a good thing that we have people working together over in Tallahassee. You ready to move to number two?
Yes, indeed.
Okay. Statewide fluoride ban rides agriculture train with future Senate president as conductor. I really like that one. That's a real train theme there. What are we talking about here, Fraser?
Yeah, it stretched my creativity a little bit there on that headline. But the use of fluoride in drinking water has become a topic throughout the country. Actually, boiling down to a local level as well. I know in Miami-Dade County, there's been some local ordinances addressing fluoride and a ban on putting fluoride in the water that the mayor of Miami-Dade County actually vetoed last week. So it's become a bit of a hot topic in the public health realm. So the state has stepped in and actually passed a statewide ban on any community putting fluoride into water. It's actually the way that language is written. It's any healthcare substance into water. So it might be fluoride is the obvious target this year, but it might be something else down the line, whether it's vitamins or whatever it might be. But anyway, Florida will join with the statewide ban. I think one other state, Utah, in having a statewide ban on putting fluoride into the drinking water. I know there's a lot of physicians are concerned about this, and some physicians are on the other side as well. Again, something I think worth monitoring into the future, just to make sure that this measure, if signed by the governor ultimately, doesn't have any detrimental impacts on public health and kids' teeth in particular moving forward. But the U.S. is joining this discussion that's been being held across the globe, actually, in several countries, looking at the impact of fluoride in drinking water too. But anyway, again, I know some of our physicians are going to have major concerns about this measure and the state stepping in and saying no fluoride statewide. So wanted to highlight this for all those folks on there that may have concerns about it.
Well, and speaking of language, I caught what you said they're boiling down there in Dade County. We're boiling the water, fluoride in the water. You're creative today. Let's just say that your head's going after Easter weekend there.
I think so. The sugar got to my brain, I think. I don't know.
There's a lot of sugar going around this Easter. I don't know if it was just every year or this year was just seemed like a little bit more, but plenty of sugar in my household. All right, moving on. The last topic of the day. We're running down to not that many topics left in session, so let's make this one a good one here. All right, number 3. Ongoing battle over tort measures continues as national report paints Florida in a bad light. What's that light, and what's going on?
So we chatted a little bit about the discussions around tort issues last week, and a bit that being a bit of a divide between the governor's office and the House leadership in particular. So on the heels of that discussion, there was a report that came out this week that I figured I would highlight, especially as we have our eye trained to the last 2 weeks of session to see what happens on all those tort bills. If you'll recall, we have the wrongful death legislation that we've been following and opposing throughout session. There's a sovereign immunity bill that would increase the liability limits on government entities, including our teaching hospitals, that's hanging out there. There's PIP repeal that's hanging out there. There's an issue to repeal the medical damages legislation. So all these tort issues are kind of floating around there. And on the heels of that, this report comes out, which was from the actually it's called ALEC, the American Legislative Exchange Council. Sorry, that was a mouthful, which is a bit of a think tank on the conservative side of the ledger, if you will. But it quotes a report that came out from the U.S. Chamber of Commerce, their Institute for Legal Reform, which talks about the tort costs in America. And it has Florida as the second worst state in the nation for the impact of tort. As far as the percentage of the state's GDP. So in Florida, it's 3.35% of the state GDP, according to this report, is sent on kind of a tort tax, if you will. And then for every household, we're third worst in the nation, that $5,768 per household is what they project is the cost of this tort tax, if you will. So on the heels of all this debate in Tallahassee about these measures that would expand access to courts and tort here in the state, this report comes out. That's interesting timing. It adds to the debate, certainly. And as we look again the last 2 weeks of session to see what's going to happen on all these bills, it's kind of a timely reminder that ultimately we all pay the freight on these things as they get passed through.
Yeah, and I got to think there's a reason behind the timing of these releases. You know, it's something that it's obviously they're going to be talking about that as they kind of try to iron these things out and figure out, what's going to get across the finish line. So, very interesting to get that little nugget there. Well, so now we're getting toward the end here, Fraser. What do we have left on the table? What do we have left?
We are. So the 50-day rule that the Senate has comes up tomorrow, which is committees cannot meet after the 50th day. So most of the committee work is done. Um, Other than the Rules Committee is the only one that can be called after that 50th day rule. So we are truly at the very end. So we're keeping an eye on a number of bills. The House is going to be debating on the floor this week a couple scope of practice bills. Again, those bills haven't moved in the Senate at all. It would take the Rules Committee to pop up and grab those bills to start talking about them now. I mentioned wrongful death. That's passed both chambers, but the language isn't the same. Sorry. I'm corrected there. It's passed the House. It has not passed the Senate yet. So the Senate may take up the House version of that this week as well. So there's a lot to be anxious about and looking forward to over here the next 2 weeks. But I think we'll all be glad when this session is over and not I'll miss talking to you every week, Joe, of course. But
Right.
other than that, I think we'll be glad to see the tail end of this year's session in a couple weeks.
Yeah, maybe we'll just get together every week and just not record. We'll just talk and think about next year and the things to come. So you're right. It's been kind of an aggressive session where there's just been a lot happening and a lot of drama, I guess you could say, in this session, which is exciting for some people, but obviously it's you want things to kind of run smoothly over there in Tallahassee. So we'll have a
Yeah,
lot to watch these last couple of weeks here.
yeah, definitely. And we should plug ourselves too. We're doing a bit of a behind the scenes look for our PAC donors at a local county medical society level. So that's coming up this Wednesday, where we're going to take a deeper dive on all those bills, what still has a chance to pass, what seemingly has died on the vine here. So for those of you that are contributors to our local PACs, we're going to be hosting that on Wednesday night. And so I encourage you to reach out and register for that event if you haven't done so already.
Yeah, and this is, I mean, it's fun for us to do this every week. We record it, and people can watch it, at their leisure. But that Wednesday event's going to be kind of a neat thing for people who are obviously interested in what's going on over there in Tallahassee to kind of jump in and ask some questions, and we'll answer them to the best of our abilities. So it'll be a fun evening, and hopefully we have a lot of people on there to entertain, to educate, and kind of get them toward the very end of this session. So
Yeah,
like we do every week, though. You ready for my musical tip, or how are you thinking?
I think we are ready for your tip of the week.
Okay, and I will say, last week I picked Krungbin, and I went to that concert on Wednesday, and it was a fun time. It was like I said, it wasn't my favorite, not my normal type of music, but it was in St. Augustine, so I actually took a half day and went down and got to see the oldest city, and really had a fun afternoon, and that turned into a fun evening. So I recommend seeing Krungbin if you get the chance. This week, my musical tip is a little bit more mainstream compared to some of the ones I have usually, but I also I know I've mentioned my wife a few times, Marissa Daraskevich. Some people know her. This is a band that she really likes, and I went to Atlanta last year to see them, and she stayed in town because she was pregnant. So if she gets the chance, they're in Jacksonville. I think she's going to go see them this summer. The band is Glass Animals, and so you hear them on the radio. They're pretty popular. They have about 3 albums. The song is Lost in the Ocean. So we're starting to get that time of year where the oceans are fun to get in again. Depending on where you are. I know down in Miami you can swim all year round, and up here in Jacksonville it's you stick your toe in until you're about right around now. But Glass Animals, Lost in the Ocean. I saw them, like I said, last summer, and they put on a great live show, and they're touring again this summer. So yeah, give it a listen. It's a little bit more mainstream, but I think people will enjoy hearing something a little different.
Nice. And a shout out to Marissa. I loved it.
Right, like, and she's a music lover, and I had to put one song in here that she really would appreciate. So with that, I think that's it for the week. Any last thoughts before we say goodbye?
No, no, this was a lot of fun, Joe. Look forward to seeing what happens this week and then recording our update next week as we head into the last week of session.
Yep, it's emotional. We'll finish this out strong though, like the lawmakers are over in Tallahassee. Fraser, it's been a pleasure.
Yep, you too, Joe. Take care.